The first bill on the calendar for the day is Senate File 1098. The clerk will report the bill.
Senate File number 1098, number 1 on the calendar for the day, an act relating to health, establishing the Prescription Drug Price Transparency Act, the fourth engrossment.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 1098.
Third reading. I recognize the member from Hennepin, the author, Representative Morrison.
Thank you, Madam Speaker. Members, Senate File 1098, the Drug Price Transparency Act, is a bill to bring much-needed transparency to the pricing of prescription drugs. The cost of prescription drugs is high and growing higher, including older drugs and new drugs entering the market. While drug manufacturers create life-changing and life-sustaining medications, these medications are useless if people can't afford them. Drug costs now represent 23 cents of every dollar spent on healthcare, more than inpatient hospital costs. The examples of egregious drug prices are legion, but here are just a few. Insulin. We've heard a lot about the price of insulin. It has nearly tripled since 2002, and the average price of insulin has increased by 64% since January of 2014. Naloxone. This drug is used to reverse opioid overdoses. One manufacturer increased the price by 600% over the last 4 years, from $575 to $4,100 per dose. Copaxone is used to treat multiple sclerosis. When it was brought to market in 1997, it listed for $10,000 annually. Today, it is listed for over $90,000 a year. Daraprim is a treatment for AIDS. The list price for a month's supply, or 60 tablets, is $45,000. Daraprim first made headlines in 2015 when Martin Shkreli acquired the drug and immediately increased the price from $13.50 per pill to about $750 per pill. The EpiPen, which is used to treat severe allergic reactions, is another example. The manufacturer Mylan raised the price of a 2-pack from about $100 to more than $600. These are life-saving or sustaining drugs. Patients can't choose whether or not they want to buy these drugs. They can't shop around for a better deal. They need them to live. The latest round of price increases just happened in January, and prices increased on more than 200 prescription drugs. These steep increases in drug prices harm patients and impact taxpayers who help pay for public programs such as Medicare and Medicaid, which provide drugs to enrollees. Creating more transparency of drug prices is an important first step toward raising awareness of the role of drug prices in healthcare. This bill is supported by a broad coalition of stakeholders. I won't name them all because it's such a long list, but you should have an electronic copy. Suffice it to say, it includes the business community, patient groups, provider groups, unions, and health plans. This bill was included in the HHS Omnibus Bill at the end of 2019. The money was appropriated and is at MDH, but there was disagreement over trade secret language, so it was not enacted. The bill we have since crafted is the result of a lot of stakeholder engagement. We worked with the aforementioned stakeholders as well as representatives of the pharmaceutical industry and the generics. Significant changes were made to strengthen trade secret protections while still requiring transparency. So here's what the bill does. It requires price transparency for 3 categories of drugs: existing drugs, newly acquired drugs, and new drugs. Reporting is similar for existing drugs and newly acquired drugs whose price exceeds $100 for a 30-day supply or a course of treatment less than 30 days. For brand name drugs, where there is an increase in price of greater than or equal to 10% over a 12-month period or 16% over a 24-month period, or for generic drugs where there's an increase of 50% or greater in the price over the previous 12-month period. No later than 60 days after the price increase goes into effect, the manufacturer must submit to the Commissioner of Health the following information: the name of any generic version of the drug available on the market, the introductory price of the drug when it was approved for marketing by the FDA, and the net yearly increase by calendar year in the price of the drug during the previous 5 years. The direct costs incurred by the manufacturer associated with the drug. So the cost to manufacture the drug, the cost to market the drug, including advertising costs, the cost to distribute the drug, the total sales revenue for the drug during the previous 12-month period, the manufacturer's net profit attributable to the drug during the previous 12 months, the total amount of financial assistance the manufacturer has provided through patient assistance programs, if applicable, any agreement between a manufacturer and another entity contingent upon any delay in offering to market a generic version of the drug, the patent expiration of the drug if it is still under patent, the name and location of the company that manufactured the drug. If it's a brand name drug, the 10 highest prices paid for the drug during the previous calendar year in any country other than the United States. Newly acquired drugs are also required to submit the price of the drug at acquisition in the calendar year prior to acquisition, the name of the company from which it was acquired, the date of acquisition, and the purchase price, the year the drug was introduced to market, and the price at the time of introduction, and finally, the price over the previous 5 years. Reporting on new prescription drugs is a bit different. For a new brand name drug with a price that is greater than the tier threshold established by CMS for Medicare Part D of $670 for a 30-day supply, or for a generic that exceeds the tier threshold for a 30-day supply and is not at least 15% lower than the referenced brand name drug when the generic or biosimilar is launched, the manufacturer must submit to the Commissioner of Health the following information: the price of the drug, whether the FDA granted the new drug a breakthrough therapy designation or a priority review, the direct costs incurred by the manufacturer that are associated with the drug. In other words, the cost to manufacture the drug, the cost to market the drug, including advertising costs, the cost to distribute the drug, the patent expiration date of the drug if it is under patent, and the manufacturer must submit documentation necessary to support the information reported. MDH will review the information and will post the submitted prescription drug price information publicly on the MDH website in an easy-to-read format. The information will not be posted if it is not public data under Section 1302, Subdivision 8A, or is trade secret information under Section 13.37, Subdivision 1, Paragraph B, or is trade secret information under the Federal Defend Trade Secrets Act of 2016. If the manufacturer believes information is trade secret and should be withheld from public disclosure, the manufacturer must describe the legal basis in writing upon submission. If the Commissioner of Health disagrees with the manufacturer's request to withhold information from public disclosure, the Commissioner must give the manufacturer 30 days notice before it will be posted publicly. There will be enforcement and penalties for failure to comply. If the manufacturer fails to submit timely reports, the information required, or inaccurate or incomplete information, the Commissioner may fine the manufacturer up to $10,000 per day to be deposited in the Healthcare Access Fund. Lastly, MDH will submit a report to the legislature annually regarding the effectiveness of the program in promoting transparency, enhancing understanding on pharmaceutical spending trends, and assisting the state and other payers in the management of pharmaceutical costs. Members, this is a pro-patient, pro-consumer bill. We have already seen Minnesotans die because they could not afford their prescription drugs. Prescription drugs do not work if people cannot afford them. We must act to increase transparency in prescription drug pricing, to raise awareness about the role of drug prices and the cost of healthcare, and help drive down those prices. I urge you to vote yes.
Discussion to the bill. Representative Gruenhagen.
Oh, thank you, Madam Chair. Can you hear me?
We can hear you, Representative Gruenhagen.
Okay, I appreciate Representative Morrison's efforts on this. Obviously, the price of drugs is a concern of all of ours. And I know that the pharmaceutical company is not a bunch of white knights. I'll agree with that. But, I originally was a co-author on this bill, but then I removed my name. Because the more I looked into it, both the bill and also talked to my local independent pharmacies, the more I realized that this probably is a step, an over regulatory step that might actually hurt patients and restrict access of needed prescription drugs. You know, the pharmaceutical industry already has to report quite a bit of information, and I think that the PBMs are more of a problem than the pharmaceutical companies. There is federal legislation that would address some of the price of drugs as far as pharmaceuticals are concerned, and I think this also is a step in a direction of single payer. Americans for Prosperity sent out a letter indicating so. So, you know, based on my local independent druggist and also a number of other reasons, I think I'm going to have to be a no vote on this. And I encourage other members to vote no also. Thank you, Madam Speaker.
Any further discussion to the bill? Hearing none, the clerk will take the roll on Senate File 1098.
Acom.
Acom, aye.
Acom, aye. Albright.
Albright, aye.
Albright, aye. Anderson.
Anderson, aye.
Anderson, aye. Backer.
Backer, aye.
Backer, aye. Bonner. Bonner, aye. Barr. Barr, no. Baker.
Baker, aye.
Baker, aye. Becker, Finn.
Becker, Finn, aye.
Becker, Finn, aye. Bennett.
Bennett, aye.
Bennett, aye. Bernardi.
Bernardi, aye.
Bernardi, aye. Bierman.
Bierman, aye.
Bierman, aye. Bow. Bow, aye. Brand.
Brand, aye.
Brand, aye. Cantrell.
Cantrell, aye.
Cantrell, aye. Carlson, A.
Carlson, A, aye.
Carlson, A, aye. Carlson, L.
Carlson L, aye.
Carlson, L, aye. Christensen.
Christensen, aye.
Christensen, aye. Claflin.
Claflin, aye.
Claflin, aye. Considine.
Considine, aye.
Considine, aye. Daniels.
Daniels, aye.
Daniels, aye. Doubt. Doubt, no. Davids.
Davids, no.
Davids, no. Davney.
Dabney, aye.
Davney, aye. Dean. Dean, aye. Damath. Damath, aye. Detmer.
Detmer, aye.
Detmer, aye. Driscollowski.
Driscollowski, no.
Driscollowski, no. Eklund.
Eklund, aye.
Eklund, aye. Edelson. Edelson, aye. Elkins.
Elkins, aye.
Elkins, aye. Erickson.
Erickson, no.
Erickson, no. Fabian.
Fabian, no.
Fabian, no. Fisher.
Fisher, aye.
Fisher, aye. Franzen.
Franson, no.
Franzen, no. Freiberg.
Freiberg votes yes.
Freiberg, aye. Garofalo.
Garofalo, yes.
Garofalo, aye. Gomez.
Gomez, aye.
Gomez, aye. Green.
Green, no.
Green, no. Grossel.
Grossel, nay.
Grossel, no. Gruenhagen.
Gruenhagen, no.
Gruenhagen, no. Gunther.
Gunther, yes.
Gunther, aye. Haley.
Aye.
Haley, aye. Halverson. Halverson, aye. Hamilton.
Hamilton, aye.
Hamilton, aye. Hanson.
Hanson, aye.
Hanson, aye. Hassan.
Hassan, aye.
Hassan, aye. Hausman.
Hausman, aye.
Hausman, aye. Heinrich.
Heinrich, no.
Heinrich, no. Heinzman. Heinzman, no. Her.
Her, aye.
Her, aye. Hertos.
Hertos, no.
Hertos, no. Hornstein.
Hornstein, aye.
Hornstein, aye. Howard.
Howard, aye.
Howard, aye. Hewitt.
Hewitt, aye.
Hewitt, aye. Johnson.
Johnson, no.
Johnson, no. Jordan.
Jordan, aye.
Jordan, aye. Jurgens.
Jurgens, aye.
Jurgens, aye. Keel.
Keel, No.
Keel, no. Cleavorn.
Cleavorn, aye.
Cleavorn, aye. Cagle.
Kago, aye.
Cagle, aye. Katiza Watun.
Katiza Watun, aye.
Katiza Watun, aye. Kosnick.
Cosmic, no.
Kosnick, no. Kreshaw.
Kreshaw, no.
Kreshaw, no. Kunish Podine. Kunish Podine, aye. Lehman.
Lehman, aye.
Lehman, aye. Lee. Lee, aye. Lesh.
Lesh, aye.
Lesh, aye. Liebling.
Liebling, aye.
Liebling, aye. Lean.
Lean, aye.
Lean, aye. Lilly.
Lily, aye.
Lilly, aye. Lippert.
Lippert, aye.
Lippert, aye. Listagard.
Litzlegard, aye.
Listagard, aye. Long.
Long, aye.
Long, aye. Lucero.
Lucero, no.
Lucero, no. Lewick.
Lewick, aye.
Lewick, aye. Mahoney.
Mahoney, aye.
Mahoney, aye. Mann. Excuse. Mariani.
Mariani, aye.
Mariani, aye. Marquardt.
Marquardt, aye.
Marquardt, aye. Mason.
Mason, aye.
Mason, aye. McDonald.
McDonald's, no.
McDonald, no. Mecklin.
Mecklin, nay.
Mecklin, no. Miller.
Miller, no.
Miller, no. Moeller.
Moeller, aye.
Moeller, aye. Moran.
Moran, aye.
Moran, aye. Morrison. Morrison, aye. Munson.
Munson, no.
Munson, no. Murphy.
Murphy, aye.
Murphy, aye. Nash. Excuse. Nelson, M.
Nelson M, aye.
Nelson, M, aye. Nelson, N.
Nelson N, aye.
Nelson, N, aye. New. New, no. Nor.
Nor, aye.
Nor, aye. Nornis.
Nornis, no.
Nornis, no. Novotny.
Novotny, no.
Novotny, no. O'Driscoll. O'Driscoll, no. Olson.
Olson, aye.
Olson, aye. O'Neill.
O'Neill, no.
O'Neill, no. Pulowski.
Pulowski, aye.
Pulowski, aye. Purcell.
Purcell, aye.
Purcell, aye. Petersburg.
Petersburg, aye.
Petersburg, aye. Pearson.
Pearson, aye.
Pearson, aye. Pinto.
Pinto, aye.
Pinto, aye. Poppy.
Poppy, aye.
Poppy, aye. Poston.
Poston, aye.
Poston, aye. Pryor.
Pryor, aye.
Pryor, aye. Quam.
Guam, no.
Quam, no. Richardson. Richardson, aye. Robbins. Robbins, aye. Runbeck. Runbeck, aye. Sandell.
Sandell, aye.
Sandell, aye. Sandsted.
Sandsted, aye.
Sandsted, aye. Sauk.
Oak, aye.
Sauk, aye. Schumacher.
Schumacher, no.
Schumacher, no. Schultz.
Schultz, aye.
Schultz, aye. Scott. Scott, aye. Stevenson.
Stevenson, aye.
Stevenson, aye. Sundin.
Sundin, aye.
Sundin, aye. Swazinski.
Swazinski, no.
Swazinski, no. Tabke.
Tabke, aye.
Tabke, aye. Tice.
Tice, no.
Tice, no. Torkelson.
Torkelson, no.
Torkelson, no. Erdahl.
Erdahl, aye.
Erdahl, aye. Vang.
Bang, aye.
Vang, aye. Vogel.
Vogel, no.
Vogel, no. Wagenius.
Virginia, aye.
Wagenius, aye. Wozlowick.
Wozlowick, aye.
Wozlowick, aye. West.
West, aye.
West, aye. Winkler. Winkler, aye. Walgamot. Walgamot.
Wolgamott, aye.
Walgamot, aye. Zhang Jie.
Xiong J, I.
Zhang Jie, aye. Zhang Ti.
Zhang Ti, aye.
Shang Ti, aye. Joachim.
Joachim, I.
Joachim, aye. Speaker Hartman. Speaker Hartman, aye.
There being 99 ayes and 33 nays, Senate File number 1098 passes and its title is agreed to.